Welcome to the physiology class. Today's topic of discussion is ovarian cycle. Ovarian cycle is a cyclical changes taking place in the ovary. It comes under the heading menstrual cycle. Menstrual cycle. Menstrual cycle is defined as the cyclical events that takes place in a rhythmic fashion during the reproductive period of a woman's life. Reproductive period indicates the period between menarche and menopause. Menarche means the onset of menstruation that occurs at the age of 13 to 15. And menopause means the complete stoppage of menstruation that occurs at the age of 45 to 50. The period between menarche and menopause that is called reproductive period of woman's life. And during this time, many changes are taking place in woman's life. These are called menstrual cycle. The duration of the menstrual cycle is 28 days. In some person, it may vary between 20 to 40 days. And duration of the menstrual blood flow is 4 to 5 days. And during this menstrual cycle, many changes are taking place in the woman's life. The changes occurs in the ovary, that is called ovarian changes or ovarian cycle. Simultaneously, some changes are also observed in the uterus also. That is called uterine changes, uterine cycle or endometrial cycle. We can observe some changes in vagina also, that is called vaginal changes. The changes in the cervix is called cervical changes. Before going to the details, we should know the anatomy of the female reproductive system. This is the ovary, the primary sex organ in female, that is a pair of ovaries. The changes in the ovary is called ovarian cycle. This is the uterus. This is the accessory sex organ in female. During the menstrual cycle, some changes are seen in uterus also, that is called endometrial cycle or uterine cycle. The primary function of the ovary is the secretion of ovum, that is also called oogenesis. The secondary function of ovary is secretion of hormones, female sex hormones, that is estrogen and progesterone. And these ovum and the female sex hormones are carried by the fimbriated end of the fallopian tube into this fallopian tube. And from here, it enters the uterus. Ovarian cycle. The changes taking place in the ovary during these 28 days, that is called ovarian cycle. It occurs in two phases, that is follicular phase and luteal phase. The follicular phase is also called pre-ovulatory phase. Luteal phase is called post-ovulatory phase. This diagram shows the duration of the normal menstrual cycle. The day 1 to day 28. Day 1 to day 14 is called follicular phase. At the 14th day, ovulation is taking place. Day 14 to 28 is called luteal phase. The follicular phase that comes before the ovulation, that's what this phase is also called pre-ovulatory phase. Pre-ovulatory phase. The luteal phase comes after the ovulation, so it is called post-ovulatory phase. Follicular phase. Follicular phase extends between day 1 to day 14. During this phase, an ovarian follicle that gradually grows into a matured Graafian follicle through different stages. These are the different follicles seen in the ovary. The first follicle is called primordial follicle. The primordial follicles are seen before the birth. This follicle includes an ovum inside the follicle. In the intrauterine life, at 7th or 8th month of intrauterine life, there are 6 to 7 millions of primordial follicles are seen in the ovary. And at the time of birth, this primordial follicle is reduced to 1 million. And we all know the ovulation taking place at the time of puberty, that occurs at the age of 13 to 14. So at that time, the number of primordial follicles in the ovary is only 4 lakh. And this is the primordial follicle. This is the ovary. That is the primary sex organ in female. And these are the primordial follicle. There are 4 lakhs of primordial follicles are there. Primordial follicle means the ovum is incompletely covered with granulosa cell. The structure is called primordial follicle. Then the primordial follicles, when it is completely filled with the granulosa cell, at that time the cell is called primary follicle. The second follicle is called primary follicle. In this stage, the follicle and the ovum inside the follicle is grows. And then the primary follicles is transformed into secondary or vesicular follicle. Here you can see secondary or vesicular follicle. Here we can see a vesicle inside this follicle. That's what the cell is called, vesicular follicle. During the proliferation, a vesicle is formed inside the follicle. The vesicle is called antrum, and that antrum is filled with a liquid that is called liquor folliculi. And that liquor folliculi, along with antrum, that push the ovum into one side of this follicle. And this vesicular follicle grows into a matured Graafian follicle. All these changes taking place inside the ovary, that is under the influence of follicular stimulating hormone or FSH. So under the influence of FSH, a primordial follicle is transformed into a primary follicle. Then that grows into a vesicular follicle, and that grows into a matured Graafian follicle. All these changes taking place from day 1 to day 14. This is the diagram of a Graafian follicle. This is the ovum or oocyte. This is the capsule of the ovum, a tough capsule that is called zona pellucida. These are the granulosa cells around the ovum, that is also called cumulus oophorus. This is the vesicle formed inside the follicle that is called antrum, that is filled with a liquor folliculi. And in this stage, a capsule is formed around the follicle. That is called theca layer. This is the theca layer. The theca layer is again divided into theca interna and theca externa. Theca interna is the loose connective tissue layer, and theca externa is the tough fibrous layer. The theca interna layer secretes estrogen. And now the Graafian follicle is ready for the ovulation. We know the ovulation taking place at the day of 14. It is a process by which the Graafian follicle in the ovary ruptures and the secondary oocyte or ovum is released into the abdominal cavity. It occurs under the influence of luteinizing hormone. And the ovum enters the fallopian tube to the fimbriated end. And what is the cause for this ovulation? The mature Graafian follicles secrete large amount of estrogen. That estrogen stimulates the release of gonadotropic releasing hormone from the hypothalamus. And these hormones stimulate the anterior pituitary to release more LH. And this occurs 2 days prior to the ovulation. That means 12th or 13th day of menstrual cycle. And that is called LH surge. This diagram shows the ovulation. This is the ovary. Inside the ovary, mature Graafian follicle is there. And this is the theca interna layer, which secretes lots of estrogen, which stimulate hypothalamus to secrete gonadotropic releasing hormone. These hormones stimulate the anterior pituitary to secrete luteinizing hormone. This luteinizing hormone acts on the mature Graafian follicle and it ruptures the Graafian follicle. The follicle is ruptured and the ovum is released into the abdominal cavity. The process is called ovulation. Then, the importance of knowing ovulation time. Ovulation time is indicated by some signs. The signs of ovulation. It is very important to know the ovulation time. We can determine the ovulation time by checking the basal body temperature with the help of a thermometer. Place the thermometer in the vagina or rectum. If the ovulation is taking place after the ovulation, the basal body temperature is more. And before the ovulation, the temperature is less. And why this difference? Before the ovulation, the hormone which is secreted, that is estrogen. But after the ovulation, the ovary secrete large amount of progesterone. The progesterone has a thermogenic effect. So the reason for the increase in body temperature is increase the level of progesterone. The next sign is changes in the cervical mucus pattern. When we collect the mucus from the vagina and that is applied in the slide, we can see a fern pattern if there is ovulation is taking place. In other time, the fern pattern is absent. So it also indicates the ovulation. At the time of ovulation, the cervix becomes softens. In some person, a pain is observed due to the time of ovulation. That is called Mittelschmerz. In some person, a white discharge is also observed. We can determine the time of ovulation by assessing the hormone or determine the hormones in the body. Before the ovulation, estrogen level is more and FSH level is more. At the time of ovulation, the luteinizing hormone is more. And after the ovulation, progesterone level is more in the blood. So we can identify the ovulation time by determining the hormone level, plasma hormone level. Next text is ultrasound scanning. It shows the ovulation time. And what is the importance of knowing ovulation time, or what is the significance of ovulation time? The ovulation time that is helpful for the family planning. It is also helpful for the pregnancy. Those who doesn't need a child, they can make utilizing this ovulation time They can avoid the sexual intercourse during these days. By that way, they can prevent the pregnancy. And those who need the pregnancy, they can use this time, and it is easy for the pregnancy. Then, after the ovulation, the next phase is called luteal phase. It occurs after the ovulation, so it is also called post-ovulatory phase. This phase extends between 14 to 28 days. This is the first phase, that is follicular phase. This is already discussed. Primordial follicle, that is transformed into primary follicle, that is transformed into secondary or vesicular follicle, and that is transformed into a mature Graafian follicle. All these changes in the ovary taking place under the influence of follicular stimulating hormone. And in this phase, lots of estrogen is secreted from this growing follicle. On the day of 14, ovulation is taking place under the influence of luteinizing hormone. Then day 14 to 28 is called luteal phase. And why it is called luteal phase? In this phase, a glandular structure, corpus luteum, is formed. Luteum means yellow, corpus means cell. A yellow colored body is formed in this time. And what is corpus luteum? After the release of ovum from the follicle is empty and that is filled with the blood. At that time, the cell is called corpus hemorrhagicum. And this blood clot is destroyed gradually, and that place is filled with some lipid granules. And these granules secrete yellow color pigment also. And finally, that is transformed into a yellow colored body that is called corpus luteum. In this stage, it is called corpus hemorrhagicum, that is transformed into corpus luteum. Corpus luteum is a temporary endocrine gland. It acts as a temporary endocrine gland. It secretes large amount of progesterone and small amount of estrogen. And this corpus luteum is maintained in this ovary by the luteinizing hormone. Corpus luteum. Corpus luteum is a glandular yellow body developed from the ruptured Graafian follicle after the release of ovum. And what are the functions of corpus luteum? It has two functions. Secretion of hormone, that is the primary function of corpus luteum. Corpus luteum is a temporary endocrine gland. It secretes large quantity of progesterone and small quantity of estrogen. Second function of the corpus luteum is maintenance of pregnancy. Progesterone is a pregnancy maintaining hormone. The progesterone is secreted by corpus luteum. So if the pregnancy occurs, this corpus luteum remains active for the next 3 months until the placenta develops. And this progesterone maintains the pregnancy. So these are the functions of corpus luteum. Fate of corpus luteum. We know the ovulation taking place at the 14th day of menstrual cycle. If the sexual intercourse taking place during that day, the sperm is ejaculated into the female vaginal tract. And there is a possibility for the fusion of ovum with the sperm and the fertilization is occurred. If the ovum is fertilized and the pregnancy occurs, the corpus luteum remains in the ovary for the next 3 months in the form of corpus luteum of pregnancy. During this period, it secretes large amount of progesterone and small amount of estrogen. And these hormones are essential for the maintenance of pregnancy. After 3 months, the placenta starts developing and which secrete these female sex hormones. And if the ovum is not fertilized, the corpus luteum degenerates into corpus luteum of menstrualis. Afterwards, the corpus luteum menstrualis is transformed into a whitish scar that is called corpus albicans. The process is called luteolysis, and that is degenerated. This diagram shows the hormonal changes during the ovarian cycle. This is the day 1 to day 14. The phase is called follicular phase. The hormone which is responsible for this phase is called FSH or follicular stimulating hormone. The follicular stimulating hormone is responsible for the follicular development or follicular growth. And at the 14th day, ovulation is taking place. It occurs under the influence of luteinizing hormone. So at the 14th day, the level of LH is more, it is increased. Then after the ovulation, the day 14 to 28 is called luteal phase. In this phase, a corpus luteum is formed which secretes large amount of progesterone and small amount of estrogen. And this corpus luteum is maintained by the hormone luteinizing hormone. That's all about the ovarian cycle. Thank you.